Have you ever been on a Zoom call and you look at yourself and you think, ugh, is that me? Is that what I look like? Do I have those under eye bags? I mean, I feel kind of tired. I've been feeling tired and exhausted for a long time, but now it's really starting to show. You might have even gone to your doctor and said, you know what? I'm tired. I'm exhausted. For my females out there, you could say, I've had PMS all year long with no breaks. What's happening? And you go to your doctor and they say, everything looks fine with your labs. They check your hormones. Everything's normal. Has this happened to you? Right? You go to your doctor and everything is normal, or even worse, nothing is there. No hormones are there. What do you do? So don't worry. In the next 10 minutes, I'm going to show you exactly how to lose excess fat, gain energy, gain confidence, and help you take back control of how you age, because you can age fast or you could age slow. The choice is up to you. Hi, I'm Dr. Erin Lucy, the beauty, body, and balance expert for busy women who want to increase energy, gain confidence, and take back control over their health without harmful birth control pills and excessive dieting. So how did I get here? In 2014, I was working in the busiest functional medicine practice doing my internal medicine residency for a family nurse practitioner. I was seeing over 4,000 patients a year, working over 50 hours a week in that practice. And I also ran a med spa on the weekends. I owned my own business. And it was something I loved to do, so I didn't feel stressed. I didn't feel anxiety about it. I just worked and worked, and I studied before work, and I studied after work. And during this time, while I was working in residency, I was also seeing the Botox patients on the weekends, because everybody needs their Botox. Once you get Botox, you love your Botox and you want to keep doing it. Those patients I love, right? But they worked me to death. So how did I get in that position of working nonstop and really ignoring my own health? When I was 16, I went to beauty school. So I became a licensed cosmetologist. I learned about hair, skin, and nails. And I loved making women look good and feel good. So that's what I did. I did that for several years, all through college. And then I wanted to help women look their best. And I started to do corrective treatments like Botox and filler and laser. But after 10 years of seeing these patients, you start to notice, is it really corrective? Right? I have patients that are 35 years old and they're going through their Botox and their filler like this. Why are they metabolizing it a lot faster? What's going on? You know, that 35-year-old had premature ovarian failure, which is a hormone disorder where you don't have any hormones. So she was starting to have bone loss in her face, and she was starting to have really dry skin, really thin skin. This should not be happening to a 35-year-old, but her doctor wasn't doing anything about it. I was just filling her face up with filler and other Band-Aids, but not correcting the cause. So you start to see more trends like this. You know, a 40-year-old coming in with stretch marks that were happening without being pregnant. That's a hormone cause. I have patients that come in with hair loss. Yes, I can fix that with some injections and some other things, but the root cause is hormones. Too much acne on the face is going to be, or face and body, is going to be hormones. So then we start to think about body contouring and lasers for, you know, little pockets of fat that we don't like. That's all hormone related. Right? So all these things I was doing in my practice to get to the root cause was all hormones. So I started to do more research in functional medicine and anti-aging medicine. But during this time, I was working so much and I loved it and I didn't feel stressed, but I was wrecking my own body. So I worked with my physician, my attending I was, working with, and he did my labs and he said, look, you're going to have you have hormone imbalances. You may not be able to have children. And at this time, I'd been dating my husband for about 4 months. I knew on our first date that we were going to get married. And I had to go home and tell him we might not be able to have children. I remember that moment. Just like my physician took my hand and told me I might not be able to have children, I had to take my husband's hand and tell him that as well. So flash forward 7 years later, we have 2 successful pregnancies and births and 1 on the way. And I can confidently tell you that you can change those habits and that lifestyle. What was happening to my patients, I did exactly that to myself. So I've created the Metabolic Makeover method for women to help increase your metabolism, help you lose fat, gain energy, confidence, and help to fight the metabolic disease process. It's a 10-week program that really helps you decrease inflammation, fight metabolic syndrome, decrease insulin levels, all things that make you age quicker and put you on the route towards death, premature death, and aging. So I have a patient named Tina, and Tina was 29 years old, and she said, "You know what? I'm not ready to have kids quite yet. I'm not married, but I've started to gain weight. My cycles have gone from 28 days to 21 days. She wasn't ovulating regularly, and she knew that this was not normal." After doing my program, after the first week from my program, what happened was she called and said, "Oh, I'm 5 pounds lighter, and I have actually don't have any PMS at all." So we've improved that. At the end of her 10-week program, she was down 25 pounds, and all of her levels for metabolic syndrome, metabolic disease were improved. Better cholesterol, better insulin. She'd lost weight around her belly. All of these things were better. Now think about if Tina hadn't have joined my program, what would have happened? She would be on her path to not having normal cycles, which means she would not be able to ovulate or have children, not being confident in the bedroom, not feeling good to perform adequately at work, right? All of these things could have happened to Tina, but unfortunately it didn't. She was able to take my program and change her life. So what I want you to do, if you're ready to help improve your energy levels, lose excess fat, help gain that energy level back, look and feel your best, go to my website, drerinlucy.com, sign up for a free discovery call, check your email to make sure that you got that confirmation. Okay, if you didn't, check your spam. Okay, and remember, if you feel like you are aging too fast and something is not quite right, you need to get your hormones balanced, get them checked, get them balanced, and then the choice is up to you. You can age fast or you can age slow. I'm Dr. Erin Lucy, Beauty, Body, and Balance expert.